Good morning, Dr. Lebo Gyno, 24-year-old from Massachusetts. Now, you're going to give me shit like I wish I had a body like that, which, I mean, it's amazing. His body fat is probably, oh my goodness, in the single digits. What are you, about 8? Maybe.
Yeah, if I had to get it.
Someone like, what's that?
If I had to guess, yeah.
Yeah, something like that. But he's got residual puberty, gynecomastia. Now lift up your arms. So it's really this. I mean, it really isn't much, but here, put your arms down just a teeny bit. So it's this little meatball right there. Is this little marble. I can roll it around. You know something? And it bothers him. It just bothers him. It's from puberty. He swears he didn't take any steroids or SARMs or testosterone or anything. This side may be a little bit bigger, though I don't know. They're probably about the same, but I can feel it, and it just bothers him. When it's cold, it's fine. When he does this or hits himself, it's fine. It tightens up, it contracts. But when he's relaxed, it's not so fine. And he wears, T-shirts, and he's proud of his body, obviously. So this bothers him, and do it. It's local anesthesia, really just minimal complications that could exist. But I'm always available. He's got my cell phone number. Any concerns or questions, he immediately calls me. He does have a history of scars, but this was an old bike accident. So that weren't sewn up there, maybe there. So we have to be very conscious about, making it perfect, making the scar amazing. Because if we have a bad scar, it's just, why did we do this surgery on this great body? So he's going to get in touch with me once, I'm going to see him 24, 48 hours later, and then we'll talk about a week later and about a month later. But he's always available to call me. And if he starts to get a little steroid, a little keloid or thickness of the scar, boom it, we hit it with some steroid, and that's about it. Both sides, obviously, local anesthesia, stealth incisions. Let's go. Let's mark them. I just alcohol them up. So that's the midline. Lift up your arms. That's the midline, that's the median. And you can kind of see the meats right here. And we're gonna make the tiniest incision and really get this out so he doesn't see anything. That's where we're gonna local, that's the muscles right there. The edge of the pec muscle. And paint the glue. Finally, my little incision where the water meets the beach. Make it as tiny as I can. I don't think I'm going to put any quilting stitches in there because it'll add to potential scar tissue.
Yeah, to come away.
Yeah, I don't think it's necessary. I don't think it's necessary. It'll just add.
Begin by introducing ourselves. I'm Han.
And I'm Franz.
And we want to pop you up.
In there. And feel underneath the gland. That's the important part. Yeah. You don't have much fat, so if I touch the muscle, it's like, remember in the lab at high school, you touch the muscle, the frog jumps?
Yeah.
Same thing. You don't have much stuff between the skin and the muscle.
What's your BMI? No. What do you predict?
I don't know much about BMI, just body percentage. He's definitely single digits. Okay? Nice. So I'm going to just make the teeniest cut. He's got small areolas, and I'm just going to go right on it where the water meets the beach, very gently. Sucker will just pop out for us. I use the local, so it's really nice and numb. Feel the thing. So you can see no body fat. You can see there's no yellow. There'll be some. We'll find a little bit of fat, but not much. But gently and easily free it up like a little meatball. And the beauty of this, tell my audience, is, you know, if perchance he wants to take testosterone or growth hormone or SARMs or whatever the hell he wants to take, this will never grow back from getting it out. So it's like removing an engine of a car. You can put as much gas in the car, but the car won't go. Same as this. You're removing the engine, you can put as much crap in the car. What do you want? But it'll never grow back. Lift up your arm in 1 second. Watch out here. Easily. Again, I haven't seen one piece of yellow fat yet. So I free it up from the nipple. Don't have to go too crazy up here. Just above the areola. It's just the gland lives under the nipple, where it starts from. Yeah. So that's good. I got my flap. Did my dissection there. And now, go down lower. See where it goes. Bring it up. Remember, you want to just be careful not to take any normal fat. That leaves the beautiful. And of course, watch out for the muscle. You can see the muscle there. And just try to keep the fascia of the muscle intact. A certain way of moving things around. Finding that beautiful plane. So of course I hydro-dissected it. So there's water in there. So it's like I can really find it nicely. Get into the tail of it. Usually the tail's a little stuck. So let's explore around it. Don't have to use big scissors on here. Away. Let's try over on the side here. Remember, you gotta get the whole gland out. Bigger than you think. And remember, you can give me shit. Give him shit. Call him an asshole. He's a big boy. He'll take it. I'll take it. But if it bothers you, some people buy Porsches, They spend money on a Porsche Turbo for 100 and 200,000, that's what they want. Some people just buy Kias, It's what you want. What do you want to spend your money on? Some people like fancy women with big boobs and,
You could get me in trouble there.
And some guys just like the big fatties that,
You're gonna get you in trouble.
get me in trouble. They don't spend much money on them.
There you go.
Are you laughing? He's asleep.
No, he's not. No ways he's.
He's taking it in.
We have fun. Yeah, it's really what you want to spend your money on and what bothers you. So, again, beautiful incision where the water meets the beach. Take your time. Good. Now lift up your arm. I like to make the incision with your arm at a neutral position so it's not stretched out. All right. And free it up a little bit. Beautiful. And again, go underneath the nipple. Okay.
All good, my man?
After that, just like we did last time. Free it up from underneath the nipple. Not to go much beyond the border of the areola. Beautiful. Nice. And underneath this. See where the gland is. I got my own little technique of pushing things down. And laterally, it's a little more stuck. All right, next you can see where the muscle is right there. See that blue popping out? So go in there, very gently separate it. You know what you're doing. Remember, I'm not using cautery because that's going to just burn and it's not as exact as my nice cold knife, as it's called. to the side. Nice. Get over it by the head. And then where it dives down. Finger in there. I think this side's a little bigger. That's what I thought, but we'll see. And really, you don't know. Can't tell how big it is. All right, so now let's get to the tail. 'Cause that's number one. That's where the blood vessels come from, the underarm. So you got to respect that and not go hog wild, because you can get these little blood vessels, and no big deal. You just have to. Snip one, you gotta cauterize it. Otherwise, that's where I find if you're gonna get a bleed, it's gonna happen there laterally. Good. All right. Make sure we're not. See, the muscle has beautiful fascia. It's like when you make chicken, you know, you got that chicken's, that nice, like that, you know, you take off the skin, you get your finger in there, you snip off the skin, but the meat, the breast still has like a little fascia, little covering to it. You want to maintain that. I always think about food. And that's this side, maybe a tad bigger. So, maybe a tad bigger. So, again, this is where the nipple lived, right there. Okay, maybe put it this way. Oops. Put it here. Wrong way. That way. And that's the body right there. The nipple lived right here. That's the head a little bit, and that's the tail going right into the armpit. Boom, boom. And the flip side is nice and smooth. Nice and smooth. And that's it. Small buried internal stitches. Nothing going through the skin. Self-absorbing, of course. Alrighty, Dr. Lebo Gyno, beautiful cases, excellent 24-year-old bodybuilder from Massachusetts. We did bilateral gynecomastia gland removal. These were from puberty, wipe that please. These were from puberty induced, not any steroid or SARMs, so he says. But we got them out beautifully under local anesthesia. Look at the glands right here. The left side was a little bit bigger. This is the left side, a little bit bigger than the right side. And that's normal, that they're not symmetrical. Stealth incisions, local anesthesia, got him out to perfection. And as you can see, he's gonna have a great hockey stick look. And he can work out, he can take stuff. It will never, ever grow back, I guarantee my results, for never to recur of the gynecomastia gland tissue. He'll continue to be fit, which I'm sure he will. And I want to see him 24 and 48 hours post-op, and he'll go back up to Massachusetts, and we'll just follow each other by FaceTime, by video to make sure everything's fine. So if you have gynecomastia, you call me Dr. Lebo Gyno, 631-424-0101, or email me at jonathanlebowitz@gmail.com. Thanks, and see you soon. Let's go.